here we are. I've got hubby Jez in with me in the bothy therapy room. Welcome, guys. You going to say hi?
Hello, guys.
We've been for a nice long walk, and we've used our muscles strongly up a really steep hill, the other side of Cheltenham. So we're thinking, just give Jez a little treatment, might as well record it and see how it goes. So this is going to be a core therapy treatment, but I might bring another couple of techniques into play. Let's see how it goes. So before starting, I just need to ask you, actually, anything I need to concentrate on, anything that's come up over the last month since I've treated you last?
Shoulder and neck is much better.
Your right shoulder was quite bad for about a month or something. Yeah, and that's all gone now. Lots of treatment, of course. And can you raise a leg? I'm going to push here and hold. Nice and strong, and hold. Fantastic. 2 together and hold. Okay, little dip and hold. Strong. Okay, so there's something going on your right side. Your belt's in the way a little bit, but I think I can get around that. Just feeling into the side of the sacrum there, called a sacro-iliac, and hold. Absolutely strong as iron. So let's move on. We're going to go this arm, this leg, and hold. Okay, not too bad, and hold. Okay, I am putting quite a lot of pressure on there. How did that feel? I just wanted to check something while we're here. So can you put 2 fingers on your jaw hinge there? Give me this arm and opposite leg and hold. Okay, not much better. So can you put that hand, 2 fingers over this side? Yeah. Give me this arm and leg and hold. That's better. So do the same on your left side, doesn't matter which hand. And hold, rock solid. And this hand over there. Yeah, give me this arm and hold. Rock solid, it is better. Okay, so what I just tested for was a TMJ issue, temporomandibular joint, the jaw. So I'm just, while we're here, going to just ease out that jaw a little bit with a very gentle movement. This is using a Qigong technique. There's no rapid movement, no pressure given, simply my thenar muscles, which are at the base of the thumbs, feeling into the jaw hinge, so that the hinge at the top of each side of that jaw, but also my hand is feeling the sides of that lower jaw there. And what I'm feeling for is any tension. Now, when I first connect here, I generally feel like a tightness, because we all hold quite a tightness at the TMJ. And as the effect of the therapy starts to take hold, I start to feel like a movement. It's like a circular movement, like it's a chakra, a very, very gentle vortex. And what I'm checking for is to make sure that the left and right sides are symmetrical, and also that the jaw is releasing a little, releasing its grip, that muscle tightness. As once the client relaxes, because they know I'm not going to do anything painful or sudden, then the jaw starts relaxing as well. Now, a TMJ can have a huge effect not just at the jaw and the head and the cranial bones, but also on the rest of the body. So it affects our walking mechanism. It's called our contralateral gait. And many of us have TMJ, jaw issues. That can be from stress when we grind our teeth at night. It can be from particular dental work where we've had to have our jaw open for a length of time, and it affects the symmetry, the spasms going on in the muscles that then rotate. There's torsion within the TMJ. And just by settling the jaw again, I'm just using my hands out in a almost imperceptible manner. I'm just settling it again so that there is some ease. And this will help not only with eating and chewing and talking and using the jaw, but also with the whole body mechanism of walking. And once I've done this, here we go, I'm going to retest the kinesiology muscle test that alerted me to the jaw. So we're going to use this arm, this leg. I'm going to push and hold. Fantastic. And I'm putting quite a lot of pressure on there, not only for myself but also for the client, to prove that it is stronger. And hold. Brilliant. And I am pushing for a length of time. It's not just a jerky movement, it's a nice good several second hold. So now I've treated it and that's passing, we can move on. Because the neck had been a problem before, I just want to check a psoas test. So I'm bringing the leg out and up to about 45 degrees. I'm going to be pushing downwards. I'd like you to hold up for me, Jez, and hold. Rock solid. Fantastic. Doing the same on the left side and hold. No movement there at all. That's a really good sign because it shows that the C1 on both sides is aligned. It's not subluxated to one side and it's not fixated to C2. But also because if there had been a unilateral failure there, I would have known that it would be further down in the back at about T12. So let's move on. I just want to check the hips. The pelvis is so important not only to physical health but mental health as well. So I'm just going to have a look at the hip bones, check that they are aligned, symmetrical. The knees look good. If I stand at the base of the couch, I like to stretch out the clothing so I can see what the joints are doing. Ankle bones, and also really good sign here that both feet are pointing upwards. Sometimes, if I just tip the camera, sometimes one foot might be pointing out particularly, or up, or in, or sometimes you get both legs right over to one side and the client thinks they're aligned, but actually when they look they realise they're not at all. Okay, putting it back. So, looking good, but I am just going to have a little check of the hips regardless. I'm just going to have a feel to see if they are intact. Can you raise a leg for me and hold? Really good. Down with the left and hold. Little dip there. Down with the right and hold. Okay, slightly again. So we're just going to see if they're tipped down one side and hold. Really good. Tip down the other side and hold. Slightly there. So I'm just going to update my notes. Okay, so I just want to check a little bit higher up the back. I'm going to twist one arm in, push it down at the deltoid. Now, Jez, if you could hold your arm into you, tuck it in, and I'm going to try and pull it towards me and hold. Really strong. Same again the other side. I'm going to try and pull away. You're going to tuck in and hold. Really strong, and I'm putting a lot of pressure there. Okay, there are some more neck tests I want to do, but that's when you turn over. How's abdomen been and digestion? Everything okay? Yeah. Can I just have a feel of your ICV? So this is halfway between your navel and the top of the right hip bone. Just having a little feel with 2 hands here on the iliosacral valve. It feels a little tense, but we have just eaten. How does it feel to you? Sensitive, yeah. Can you put 2 fingers there? Doesn't matter which hand. Yeah, so pressing in as firmly as I was. Raise a leg for me. I'm going to push and hold. Yeah, so that's really strong. I think it's fine. It's just the fact that we've just eaten. But while we're here, let's do some other tests. Can you put a whole hand here? Raise a leg and hold. Really good. I'm just going to find a few tests. We're not doing every one today. Raising the leg and hold. Really good. Let's do this one. Coming in the side here and hold. Fantastic. So when I'm doing tests, I don't generally say what I'm testing because the client will have a perception of what they think that organ might do, fail or pass, and that will affect whether they fail or pass that test. So I just tested the liver and then the anxiety point and then the spleen, and they're all really strong, so that's great. So you can turn over. All right. Okay, so can you bend this leg? And can you raise the knee off the couch? I'm going to push here and hold. Okay, not bad. So what I'm testing here is the glute maxes, and that should be one of the strongest muscles in the body, but quite often fails. That's quite a strong one, and I'd hope it would be because of the amount of walking and cycling Jez does. And then bend this knee, raise it up and hold. Having said that, if it was to fail, which it has done a lot in the past, it's probably because his C2, so that's the second bone down just below it's the atlas and axis, isn't it? So it's the second bone down, C2 in the neck, and that does that feel sore to you? Slightly, okay. I mean, Jez is very tall and has a long back, so the neck does take a lot of strain. We are looking after it, so it's much better than it used to be, but I will be giving the neck some TLC today. So I'd like to check your sacrum because a little bit of the hips were out earlier. So can you put your little finger and thumb tightly together? And I'm going to try and pull them apart. This is a kinesiology test called Opponens Polysis. I'm going to try and pull and hold. And hold. And hold. And hold. And hold. Yeah, nice and strong. Just going to test that lower sacrum again and hold. Yeah, so it's just slightly tweaking on that lower sacrum. So that might be indicating not only the lower sacrum but even the coccyx can come up in kinesiology. Right, so I'm going to start treating you now. So first of all, just doing a little Tuina Chinese massage, which is always, well, generally through clothes. It's a rocking mechanism where, first of all, we're just feeling the back, the spine. We've got our thenar muscle and thumb, this side of the hand, or both hands, working into the edge of the vertebra. So we are, unlike with aromatherapy massages, we are applying pressure to the bones, the skeleton. And we're rocking to see if there's any particular spasm, cramping, fixation, subluxation anywhere. But also if there's any heat or cool, also if there's any pain for the client. We're making sure that there is a beautiful flowing, rocking movement going on down the body while working. So you can see the pelvis gently rocking from side to side, which is an excellent sign. Jez does get regular treatments and this will really help his spine. So those people I see maybe who have never had a core before, or maybe even never had any complementary therapy before, and they come for a treatment, and once I've done the kinesiology muscle tests, I'll work like this into the spine with some Tuina, and the spine does not move like this. It will move like one solid iron bar, like I'm rocking the whole thing, and the whole body will rock rather than waving down the body, down the vertebrae to the pelvis. So this pelvic wave here is so lovely to see as a therapist. That's exactly what I want. Once the back has warmed a little, relaxed into the treatment, then it starts revealing itself to the therapist as to where any even smaller irritations and spasm might be. And I'm feeling, see, this isn't too bad there, a tiny little bit here, lower lumbar. But then if anything, this is the tight area, so it's higher thoracics, maybe 1 to 6, something like that. Having said that, I know that the lat dorsi test I did earlier, when Jez had his arm by his side and I was trying to pull it away from him, they both passed, and if they were bad, they would have failed either uni or bilaterally, and that would have indicated a T5 or 6, either subluxation or fixation, depending on whether it failed one or both sides. And they pass, so I know it's not that bad, but I am still feeling a little bit of tension. So I'm suspecting that it's coming from a little higher up, above T5, T6. So it's about here, like T3, 4, about there. So what I'd like to do is not only do some nice long Tuina, and I'll be working with some techniques like a wing stretch and a drunken walk and a scapular float, all things that help the upper back. And I might bring another couple of techniques in that I'll show you on a separate video. So it's really good to work into the sides of the glute as well, especially down that edge of the sacrum. You can trace the thumbs down a line. Now that can be quite sensitive with people. Some people got very toned muscles here, either from sports or lots of walking, and that might make it a little bit sensitive to touch and manipulate. But the worst thing is when their glute maxes are failing in their kinesiology muscle tests, which is then affecting their neck or vice versa. And therefore this exercise is lovely to do, which I'll show you now, called a soft tissue release. So I'm going to apply some pressure. Jez, can you bend this knee for me? Yeah. Hopefully this won't be too painful on you. Just hold your foot there. I'm going to apply pressure with a couple of thumbs. And now if you'd slowly like to lower your foot to the couch. How did that feel? A little bit sore. Okay, just raise it again. So we're going to do a few here to try and release that tension, and lower again. Okay, hopefully this will dissipate. I'm just working into it with a little Tuina at the same time. And again. Good, some nice heavy breathing going on, that will help. Was that sore? Yeah. Okay, let's do a couple the other side. It is a very sensitive muscle, yeah, and we have a lot of ligaments there that are holding the pelvis together. Okay, so can you raise that again? I'm just going to apply some pressure and lower nice and slowly. Oh, nice, good deep breath. Well done, well done. Is that all right? Yeah, same again. We're going to do another couple. So I'm applying pressure quite strongly, but slightly different location each time. And I can feel what's going on in the body when it's working. Okay, one last time. Oh, nice, good deep breath. It's really good to breathe out with a big sigh like that. It gets rid of any pain and tension. Massaging down the edge of that sacrum. Massaging onto the sacrum. Nice flat plateau of bone. And up into the waist, the obliques, the kidneys. Beautiful. And then the rounded part of the back, which is about T10. Of course, all of these will help with breathing, breath, lung capacity, help us recycle our breath, bring in new oxygen. Great. This is the area I want to work on here. I can feel a little bit of tension there. So I'm just going to do a move now, which is really nice to do. Okay. So I'm bringing one hand across the shoulder, pulling it down, while I use the other hand and wrist to push up. And that opposing direction helps soothe, stretch the muscles and skin of the upper back. Does that feel okay, Jez? It's very good. Okay. Yeah, that will help. And then the same again this side. Really good to hold the bottom tip of the scapula while I'm working it down, pushing up while I'm pulling down. And I'm making sure I'm not on the spine itself, I'm just to the right of the spine with the base of my hand. Great, okay, so now we're going to do a wing stretch. So I'm going to take the arm, give it a gentle tug. Now this is not only going to help the arm, it's going to help the whole top of the shoulder point, the scapula, deltoid, trapezius. I'm going to bring my hand through, support while I rotate. And I'm rotating in like a 3D circle. So I'm coming down, back, round. And then trying to reach as far as I can to help support and pull, stretch the whole scapula away. Give it a nice rock and a stretch and lie it back down. Massage it, Tuina it back, and then push it down a little. How we all do, we tend to bring our shoulders up, and it's nice to remind them that they can go down again. No, it's alright, I can. Okay, so coming round